No, that's a really great answer. So you obviously perform most of those surgeries in the clinical setting, right? In the office, etc.
Right.
Can you just walk us through, let's say, a patient that's coming to your office, what does that day look like? And what do you tell them about post-op care? And should they, well, even pre-op, should they take their medication? And just walk us through so someone who may not have access to you so they can understand what that process is like.
Sure. So if we're talking about an early enough melanoma where we don't need to investigate lymph nodes and we don't have to send them on to maybe a tertiary care center or the hospital, or maybe something where they're going to have their lymph nodes removed, and it's simply going to be an excision, then we usually meet them first in consultation. And we want to tell them that on the day of surgery, they can eat a good breakfast. They're not going to be knocked out typically with general anesthesia or even IV sedation, but it's going to be done under local. And most people can relate to that for having been to the dentist.
Sure.
In our practice, I'm very fortunate to work with my husband. So we want to tell them that actually it's a one-stop shop. And when they have their melanoma excised, they're going to be whole again because they will be repaired or reconstructed on the same day. Some of the melanomas, I, as a dermatologist and a dermatologic surgeon, as you well know, we're able to handle those. And others that might require a little more finesse, or maybe the melanoma is in a more critical area, very close to the eyelid or the nose, might be beneficial to have working with a plastic surgeon, so that they can have reconstruction by someone who has that fine-tuned skill set that they might require. But we tell them to eat normal breakfast, and perhaps if they're on blood thinners, we check in with them beforehand and see if we might be able to stop them. They have to consult their doctor who prescribes the blood thinners, because sometimes they really cannot be stopped and sometimes they can. And there are circumstances where if they cannot be stopped, we work around it. We still will excise the melanoma because that's important to remove the bad cells with a nice safety margin. And we reassure them we are able to stop the bleeding in the clinic. And when they go home, they might have more bruising, but to stay in touch with us, because sometimes there's a risk-benefit ratio, and there are people that have had strokes or
Sure.
have problems where they really can't stop the blood thinner. But as we know, melanoma must be treated. And we tell them that it's going to be about a 1 hour procedure, maybe 1.5 hours total. And if they feel like they need a little tranquilizer or something, we do have a little Valium for them, but it's really nothing that they have to fear. They're going to be okay. That's basically what we tell them.
Yeah, a couple other things I just like to add. So I usually tell my patient, if they can avoid fish oils, right, and as well as, let's say, ibuprofen for pain at least 7 days before, because those are not critical, but they can cause increasing bleeding. And
Question about that.
yeah.
And nowadays there's just so many medicines that people are on, that we ask them for just a list of the medicine, and we do ask them supplements beforehand. And that's a very good point, because it's important, I think, for people to tell the physician everything that they're taking, because they may think it doesn't relate, and it might. And it's always going to be easier. And we're talking now about the cosmetic result. What we don't want, if we can prevent it, we don't want what's called a hematoma, and to have blood underneath the wound that's going to swell everything up, might even open up the suture line. We want to stack the odds that it's going to be a really nice healing and the best scar that we're able to give somebody, and the best cosmetic results. So that would be an important thing to go over, all the medication.
Yeah, so always we talked about the risk of pain, infection, bleeding, and scar. Hematoma is obviously one of them. And no, how do you bring the patient back for suture removal?
So suture removal depends on where the melanoma excision has been performed. Quite typically, if it's on the face, we might bring the patient back for between 1 and 2 weeks, depending. If it's on the trunk, it might be more like 2 to 3 weeks, depending. And if it's on the lower extremities, it might even be 3 to 4 weeks, depending. And those things have to do with how we've sutured, maybe what the size of the suture line is, or if a graft was needed. But in general, we know that the circulation is better on the upper part of the body. And so sutures are going to come out sooner on the face, a little bit later on the trunk, and perhaps even later on the lower extremities.
Yeah, and the one other thing I always tell patients is when they take out the sutures, let's say 10 days or so, the wound is only about 10% of its initial strength. And then also tell patient there's another layer of sutures underneath, and they call it subcutaneous absorbable suture that still holding the tissue together. So they have to take it easy a little bit.
Right. We know that those, as you know, usually dissolve between 90 and 120 days. But we also want to stress to the patients that there are phases of wound healing.
Sure.
And beginning, we call it the inflammatory phase, and our blood cells are coming to the area, and it could be a bit inflamed, and it's a fresh new wound. And most people will listen to us and take it easy when the sutures are still. You're quite right. Once we remove the sutures, what may happen maybe at around a month and a half's time, sometimes it can look lumpier or more inflamed, and patients will be a little concerned, is something going wrong? And I try to explain that that's usually what we call the proliferative phase of healing, and that maybe more blood is summoned to the area, and it might look like something's going wrong, but honestly, the underneath sutures are still there. They're going to eventually dissolve, and your body is trying to make collagen, which is, the strong protein in our skin that's going to actually give the scar its strength to be a good scar. And that's a normal part of healing. And then eventually, maybe after 2-3 months, the proliferative phase is over, but you still have a remodeling phase that could go on for a year or even longer, where everything's going to be okay. Things are going to settle down. No one really has a red, angry scar forever. Things usually, most people understand that the scar eventually becomes flatter and usually either lighter or darker than your surrounding skin, usually lighter, but it's going to be okay. It's just at the beginning, people can worry because the scar does go through phases of maturation.
So